Hi, I am Dr. Sid, and welcome to Scoliosis NYC. Today, I want to talk about something that surprises almost every parent I meet: the real causes of scoliosis. Most people are told scoliosis just happens, but that is not the full story. The myth of no known cause. Roughly 80% of all scoliosis cases are labeled idiopathic, meaning there is no officially recognized cause. But that doesn't mean there aren't causes, it simply means the medical community hasn't agreed on them yet. Over the last decade, research has made tremendous progress uncovering the real biological factors behind scoliosis. The genetic connection. Several genetic and genomic studies have shown that specific genetic variants can increase a child's risk of developing scoliosis. Some genes make it easier for the spine to begin curving, while others make it more likely that a small curve will progress into a larger one that might eventually need surgery. Genetics may set the stage, but they are only part of the picture. The hormonal factor. About 90% of females with idiopathic scoliosis are known to have at least one hormone imbalance. One of the most significant is low progesterone. In fact, studies show that girls with idiopathic scoliosis often have half the progesterone levels of girls without scoliosis. Since hormones regulate muscle tone, bone growth, and nervous system balance, even a small deficiency can have a big impact on spinal development. Neurotransmitters and bone health. Another important piece of the puzzle involves neurotransmitters like melatonin and serotonin, which help regulate posture and balance. Disruptions in these chemical messengers are often found in children with scoliosis. We also know that up to 1/3 of patients with idiopathic scoliosis have osteopenia, or low bone density. Many also show deficiencies in vitamin D3, which is essential for bone strength and growth. When bones are weaker, they are less able to resist the pulling and twisting forces that contribute to spinal curvature. Digestive and metabolic factors. A newer and equally fascinating finding is that many scoliosis patients also have functional gastrointestinal disorders, things like poor digestion, nutrient malabsorption, and chronic gut inflammation. These digestive imbalances can interfere with nutrient uptake and hormone balance, creating a perfect storm for curve progression. What it all means. When you look at all of this together, it becomes clear that scoliosis is not just a spine problem. It is a whole body condition that affects and is affected by multiple systems, including hormones, neurotransmitters, bone health, and digestion. If we want to truly prevent scoliosis and improve outcomes, we must study and treat all of these interconnected systems, not just the curve we see on X-ray. I am Dr. Sid, and thank you for watching. At Scoliosis and Neurospine Care, we are committed to understanding the true causes of scoliosis and creating smarter, science-based solutions that address the entire body, not just the spine. Scoliosis and Neurospine Care Smarter Science. Better scoliosis care.